All right. So we've talked. I know I've really gone on and on about skin to skin, but I can't say enough about it. And this is obviously what's going to happen right after you're done having your baby. Is you want immediate skin to skin. It should be. Ideally, it should just never stop. I mean, but they're gonna have to take the baby eventually to do some things, weigh him or her. At least an hour, you know, I beg you, at least an hour. Keep that baby right there on your skin. I know we've mentioned it before that if for some reason you, as the mom, cannot do it, guys, you be ready. Take that shirt off and you hold that baby skin to skin. And we're gonna talk about all the good things that it does and why it's so important. And that it can be done after a C-section. APGAR, that's a lady's last name, but that's the test that they do on babies that test like their gripping abilities and now I've just drawn a blank, but all the little things that they need to make sure baby's doing okay, and then they get a score. It's an APGAR score. All those things can be done while baby's laying right here. You know, they just turn baby where it needs to be, check their spine, do all those things. Just say, please just leave the baby right here while you do all that. Okay, hang on. Okay. So, some of this gets a little wordy, but these are all the benefits and why skin to skin is so important. Thermoregulation and temperature maintenance. Fancy way of saying it helps get your baby's temperature where it needs to be. You know, it's been inside you at a nice 98.6 degrees, but once it comes out, your baby's not able right away to regulate its own temperature. So if it gets, you know, if it gets cold or hot, it can't fix it, but your body can. Did you know that a mom's body temperature can go up or down by a full degree to help get baby where it needs to be? That's your body's. Your body's, it's amazing what your bodies can do. And that's just one more thing that your body can do for your baby is help regulate the temperature. Same idea, the temperature synchrony between mother and newborn. Cardiorespiratory stability. So it helps get your heart, the baby's heartbeat in the right rhythm. It just helps, basically helps stabilize everything. Your baby, if you think about this, has been in this nice protected, warm, quiet place, for the most part, quiet place. All of a sudden it's out in this crazy world and overwhelmed, and there's all kinds of things just flying at this, you know, the lights, the sounds, everything. It's just overload. And your baby's body's not ready just to work automatically. But being on your skin and being back on its mother, on its own home where it's been for 9 months is what helps all those things calm down and relax and start regulating themselves. But without that skin to skin, your baby's just left to its own devices, and it can't do it by itself. It will facilitate self-attachment for breastfeeding. Higher blood glucose levels. Again, it's just one of those things where it helps your baby's body do what it needs to do, so it helps the sugar levels get where they need to be. Infants' hands and feet warmed within 90 minutes of initiating skin to skin. You know, because circulation has to get to working really well and keep baby warm, and so being on your skin helps that. Infants cry 10 times less and for shorter periods than if you put them over in their crib. Why is that? Because your baby knows you. Your baby feels safe and comfortable with you, so it's going to cry less. Plus, food is right there. You know, like your baby wants to nurse, even if there's no milk there yet. You have colostrum, and that's just a comforting thing right there is to breastfeed, even if there's nothing coming out.
It helps.
It helps it come in, exactly. So having your baby with you and not in a crib is going to help your baby cry less, which is going to help you stay more calm. It just, you know, increases the affection and the bond between you because you're holding your baby and looking at your baby. It makes breastfeeding more effective, or you know, it's going to be a more effective procedure. Your baby will spend less time in the nursery if the baby's with you on your skin, obviously. Now, this one's interesting. I didn't know this, but it's going to help synchronize yours and your newborn's sleep time. Because if your baby's laying on you and you're asleep and you're, you know, in that kind of mode, then your baby's going to kind of follow suit. And not right away, obviously, but you know, I found this interesting. When your baby's in your belly, when you're moving around all the time, That's rocking baby to sleep, so baby's sleeping all the time. But then when you lay down and you're still, then the baby's like, oh, nothing's going on. Okay, I'm awake. So your baby's kind of on opposite sleep schedules of you at this point, right? I mean, if you notice that when you lay down to go to bed, that's when all the moving goes, punching the mattress and all that good stuff. But the more time your baby spends on you and with you, the quicker, I mean, no, your baby's not going to sleep all through the night. That's not going to happen. But the quicker your baby is going to get into a better sleep pattern and synchronize with you. And you're going to be sleeping intermittently at this point. You're not going to be, having 8 hours of sleep at night and awake all day. It's going to be different. Let's see.
And the first time your baby sleeps through the night, you're going to wake up about the first time that they normally wake up, and you're going to go,
oh yeah. Major adrenaline rush at that point. You're like, what? Why did my baby not wake me up? Yeah. It reduces apnea and it reduces the amount of weight loss that your baby experiences at the beginning. Okay? And I think I've got a few more because the list just goes on and on. Positively influences state organizations. And again, these are kind of wordy, but it's basically saying the moving from sleep to awake and back and the baby's motor systems and stuff like that. All of that is positively influenced just by being on your skin. I mean, that's what's so cool is you're benefiting your baby so much, and it's something so small and something so natural anyways. It's something that you want to do. I mean, once your baby's there, your family might not be happy with you because you're not going to want to give baby up. You're going to want to hold them right there all the time. More restful natural sleep cycles, more quiet sleep, reduced stress, and reaction to painful procedures. So, we talked about how when we reduce our stress, we feel less pain during our labor, right? Well, your baby's going to have some shots. They're going to have some blood draws from their heels and stuff like that. They're going to have some things done to them. And this is all new territory for a baby. They have never felt pain before, right? So if your baby can be on your chest and feeling comfortable and have, less stress, then those procedures are going to be less painful for your baby too. So I just made this up because I thought, well, this is what I think of, is your body was your baby's home for 9 months. It doesn't stop being his or her home just because the birth is over, okay? Think of it that way. Think, yeah, my baby was inside me and that when I was the home, but just because the baby's out, I'm still their safe place. I'm still their home, and you will be for a very, very long time. You guys know. When little ones fall down and they get hurt, what's the first thing they want is to crawl up on, mommies and daddies. They just want to be comforted. Well, babies are no different. Babies are not meant to just be wrapped up and put over here and oh, how cute. No. Have them right here, okay?
My daughter still thinks she has ownership of my body a year later.
Yes, they do. Especially if you're continuing to nurse. You're not going to feel like you have your body back for a long time. Okay, so we're going to talk about inductions and interventions a little bit. Okay, so when you're getting to the end of your pregnancy and you're ready to, you're just ready for baby to get here, right? Well, first, before I know you're going to read that anyways, but one thing I want to talk to you about due dates. So, I know that your doctor's going to give you, has given you a date. How many of you think that you're actually going to give birth on that date? That's probably not going to be your baby's birthday, right? They say that you're pregnant for 40 weeks. Okay. Well, they're calculating that off of the first day of your last period, right? Okay. I can tell you from at least one personal, not me, but someone that I know that had in vitro fertilization, they had an egg implanted in them. They know physically what day, I got pregnant on this day. They go to their doctor's office for their first visit. Well, what was the date of your last period? And they're like, no, but I was implanted on this day. They're like, no, we still calculate it that way.
Really?
Yeah. Yep. Because, okay, some of you, and I have another friend that, to the day, she knows the day she conceived. And it's all because of, husband going out of town, and et cetera, et cetera. I mean, like, she knows. I mean, there is no possible other date that it could be, and yet that doesn't matter. They're going to calculate it off of the first date of your last period.
Huh.
Okay. Now, how many of you, if you've ever tried to get pregnant, have been, you know, following your cycles and all that kind of stuff? Okay. Is it an automatic 28-day cycle? Do you ovulate on the exact day that your app or whatever says you're going to?
I don't know.
Okay.
I told my husband that either we do it today or we have to wait till next month, and we both had.
Well, that's a good
virus.
motivator right there. Yeah.
We both had a horrible virus, and
There you go.
I chewed his head off one night, and I was like,
What could that mean?
hold on, I'm gonna go to the store real quick.
Yeah. So, if you ever have calculated your cycles, I mean, most of us are not 28 days. And we're not, oh, I ovulate on this exact, 14th day of the cycle or whatever. So all of this, my point being, due dates are not an accurate science. Haven't been ever, and until they change the way they calculate it, won't be. Okay? I've heard people say that it would be more accurate and more beneficial to give somebody a birth month, like not just the month of August, but like from months here, July, August. So like from July 15th to August 10th or whatever, like give them a window. Sometime within this time frame is when you could give birth. And that's, because they say you can go 42 weeks. Okay, well, but if you're given a magic due date, gosh, once you pass that due date, that's torture, isn't it? Oh, I can't go past this date. I've waited this long. I'm ready to have this baby. So even though those few extra weeks on the end of that are perfectly safe, and your body may just need that extra time, your mental state is, no, you told me this date, and I'm ready for this baby to be here. Okay?
Like with my daughter, she probably should have stayed in there another week or two. She was 5 pounds at full term.
So I'm glad you brought that up, because do you guys know what the last thing is to develop in your baby?
Body fat.
Is it? What I've been told is lungs.
Oh.
Like,
Yeah.
There's things, body fat, no, I know what you're talking about, because you're right, babies put on a lot of weight right at the end, like a pound a week or something like that. But as far as being fully developed and for, being ready for the world, the last thing that's finishing up is your baby's lungs. So you want to give that baby all the time they need to finish growing those lungs, right? So there has, and this is a great thing that has happened in the last, I guess it's been going on for at least 10 years now. I don't even know. Anyways, they started an initiative in Oklahoma called Every Week Counts, because there was a tendency to just start inducing at, 37, 38 weeks, oh, you're fine, you're close enough, let's just go ahead and induce for convenience sake, because your doctor's going out of town, because you really are just done and you want to have this baby, things like that. And that was just becoming way too common practice. And they were seeing the results in babies' development, that they just weren't quite ready. So the Every Week Counts initiative basically was to educate doctors, or re-educate them, or whatever, to understand that waiting till 39 weeks, at least 39 weeks, is the best case, is the best plan, obviously we know it'd be best just to wait and let baby come when baby comes, but the goal was to have them wait till at least 39 weeks. Give that baby all that time to finish growing, and quit, unless it's a medical reason for it, like preeclampsia, high blood pressure, and other, things that warrant going ahead and inducing, wait till 39 weeks. And that's been very effective. But obviously we're here today to talk about trying to avoid induction altogether, and just waiting until your body goes into labor. Just try to wait and be patient. And I know it's going to be hard when you get to the end, because you're going to be done being pregnant, and you're going to know that you had this special date that they said was your due date. But even if it gets to that point, try to remember that the longer your baby can grow, the better off your baby's going to be. You've waited this long, give it another week, you know? As long as you're not in any danger, you're not having any complications, just wait. Just let your body do what it needs to do. Now, that gets us to talking about when you're at that point and you are ready to, let me see, where are we? Talk about due dates. Okay. Oh, and I wanted to tell you this because I found this out the other day too. The average first pregnancy is 41 weeks and 1 day. So if you don't do anything, if you don't induce and you don't, interfere or whatever, if you just let every first pregnancy go to term, the average is 41 weeks and 1 day. So really, take your due date, since it's your first, take your due date, add a week and a day, and just say, well, that's my due date. And then, if you go into labor early, then you'd be like, yes. So, I just thought that was interesting.
Born on my dad's birthday.
Do what now?
I said, so this baby is gonna be born on my dad's birthday.
Oh, well, there you go. Okay, so say you're at that point, though, where you are just done being pregnant. It is hot, it is summertime, because I know that's you too. And you want to get this baby out, okay? None of these things are guaranteed to make it happen, but these are all things that you can do on your own at home to kind of help spur things along, okay? Now, I want to definitely state that everything should be cleared by your doctor, okay? You want to make sure that you are okay to exercise, you're okay to continue to have sex, you are, that all of these things are safe. You don't want to just, especially if you've had any complications or anything, check on these things first. And you may, I'm sure you've heard of people that are on bed rest or have been told not to have sex and different things like that. Obviously, these are not for them, and they won't be for you if that's what happens as your pregnancy goes on. But anything that gets your heart rate up, exercising. Now, you can go for long walks. Nice catch on the cookie. If you already do exercise, there's no reason you can't continue to exercise all throughout your pregnancy. You can check with your doctor on the things that you need to change. There are some like lower body stretching, like from side to side that you shouldn't do. Obviously, you don't want to lay on your stomach and do push-ups. There's some things that you're not supposed to do. But if you've been exercising and you feel comfortable with it, continue to do your exercise. I know that at the time when I was pregnant with my second one, I was going to the YMCA nearby, and I remember trying to do planks at like 8 months pregnant. It was not fun, but I tried it. And then I was like, I might be done with this. Okay, so if you are okayed by your doctor to have sex obviously releases oxytocin. We mentioned before that oxytocin starts prostaglandins, and prostaglandins are what starts your labor, okay? And so it can help start contractions. Now, if your water is broken, obviously this is not on the table, or if you have any sort of placenta placement issues, again, so that one is definitely, you need to make sure that it's okay with your doctor. If your doctor's never said anything about it at the end, you're probably fine, but you might just want to check. But anyways, so sex can help bring on labor. If you're close to the end, it might spur things along. Same with nipple stimulation. So we're talking about oxytocin, right? Because that's what can help get your labor going. Well, we talked about oxytocin is also what gets your milk to let down. So if you already have a pump at home, you can get that pump out and start practicing. I mean, and you might get milk. Some people have milk early on, but even if you don't, just the act of pumping kind of simulates what your baby's going to be doing, and that's going to get your oxytocin going, and that can help get your contractions going. Acupuncture. I've never done acupuncture. Do you know about, you do massage. Do you know anything about it?
I do acupressure.
Okay.
Obviously, I haven't done the years of schooling for acupuncture, but there are a couple of people locally that do it.
Okay. So if that's something that interests you, and I should have included acupressure. I don't know why I didn't, because it's the same idea.
Yeah, it's the same concept, just not
needles, but
Yep.
pressing.
Yep.
So now, please don't perform either one of these things on yourself, obviously. Even acupressure, because acupressure is something that you need to know what you're doing, right? So you don't just want to be like, here, honey, press right here for me, or press, don't look it up online and then ask somebody to do it for you. Go to a professional. Go to her.
I
Go
have
to Tana.
successfully confirmed one person that I have actually put into labor.
Have you?
Yes.
Okay, so proof positive, it can help. And it's the same, it's all the same idea that we're stimulating our bodies and we are getting the oxytocin to release, and that can jumpstart your labor, okay? Membrane stripping, did you say you had that done?
Uh-huh.
So you can tell us about,
Okay, people are gonna tell you it hurts like hell. I'm gonna tell you it didn't feel any different than a pap smear.
okay, so discomfort but not,
Yeah, I mean, nothing going down there is pleasant unless it's actually having sex.
right?
But, it wasn't horrible. It didn't really do a whole lot, but maybe if we'd have gone in and stripped them again, if I hadn't had the preeclampsia,
Mhm.
it could have.
Okay,
But I mainly did a lot of walking. I did not do a lot of squatting. I think if I would have actually opened my hips more and done the squats,
help
that
baby
she
work
would
down.
have come down further, and then I would have actually been able to break my water and not had to be induced.
That's a good point, because head pressure on your cervix is important. You know, your baby getting down low enough to start putting pressure on your cervix, like the ping pong ball, that's what starts pressing things and spreading it out. So,
I also don't think that she was big enough.
She wasn't-
to-
just strong enough to get down.
Yeah, because I mean, she was tiny.
Yeah.
She looked like a little baby doll. Like,
My baby doll is probably bigger than hers, or probably than she was.
probably.
So basically, membrane stripping is when the doctor separates the amniotic sac from the cervical area. So, you know, they're gonna go up in your cervix and they're just gonna kind of strip, your sac is attached inside your uterus and into your cervix and everything, and they're just kind of stripping that away and just kind of releasing it. And that kind of just simulates what would happen if you were starting to go into labor and things just start kind of, you know, separating and moving and all that kind of stuff. So it's just kind of trying to get things going. And it's a fairly natural way of doing it. So I would consider this to be a good option if you have gone past your due date and nothing else is working, and so you're like, okay, I want to try this, because it's not chemicals, there's no drugs, there's nothing like that. You can try this one. Now, your risk that you run into is that if they break your water, well, then you're on a timetable. Because if you break your water, there is a limited amount of time that you can, you know, be in labor, because eventually your baby's going to be without any amniotic fluid.
Isn't it if your water actually completely breaks, isn't it 24 hours?
I believe so. I would have to, I didn't like put that stat in here, so I don't know for sure, but that sounds right. But as soon as your water breaks, you're on a timetable. Now, if it's just a little leak and you're just losing a little bit at a time, you know, like if there's just a little break maybe up inside your uterus, and so when you have a contraction and it just kind of squirts them out and you feel like you're peeing yourself over and over, sorry, but you are. That one's not as, you know, time dependent, I guess you could say.
Right.
They'll keep an eye on your amniotic fluid. They'll make sure that you have enough in there to keep, you know, the baby's not in distress or anything like that. But just keep in mind that that is a risk, but it is a less invasive way of doing things. So
I
these
think
are,
it's 24 if it's clear, 12 if it's not clear.
yes, I agree. That is true. The color of your fluid is definitely a factor, because that
Because
could
if
mean.
it's stained, then they gotta get baby out of there before it gets meningitis.
Right. Okay. So, those are your non-medical ways to induce labor. Okay. Now, this is the ICEA statement on inductions. ICEA takes the position that obstetrical intervention and technology should only be used in the presence of medically valid criteria, and early induction methods should only be performed when a thorough medical assessment has been documented. Examples: high blood pressure, gestational diabetes, preeclampsia, hypertension, fetal growth restriction, bag of waters is broken, or pregnancy goes beyond 42 weeks. So this right here this is your list of, okay, sorry, you've got to be induced. I mean, there's, you know, my doctor's saying, oh, well, you're measuring big, we're going to do a C-section. Well, I can push back on that. These are big deals. So if your doctor comes at you with these and then they say you need to be induced, you know, we can talk, we'll get to a question and answer thing that you can use with your doctor, but if it's these, you kind of got to go with what they say, okay? So these are the good reasons, and these are why we are thankful for medical intervention and why we know that it's good for us is because it can help save lives when you do enter into some of these issues. So, let's move on to the next one. So if your doctor says that you do need to be induced because of any of those reasons, and we're not talking of, our non-medical ones that we just went over before. These are some of the options that you will be given. And you can look into these yourself and do a little bit more research, but I'm just going to give you some information on them. And you can also talk to your doctor about them. And of course, if they come to you with, hey, you're going to induce, these are your options, then that's a good time to also ask them a bunch of questions. But cervical ripening, you guys have probably heard of that. Basically, they just take a suppository of some kind and put it up near into your vagina, up near your cervix. And it has some medicines in it that are basically just going to work on your cervix to soften it and to shrink it and to try to get it doing what it needs to do. And then ideally, when your cervix starts changing, then your body goes into labor. That's the hope with that. They also have a substance or something that they can put up into your vagina that absorbs water. So it's basically kind of drying things out. Same idea, kind of dries out the cervix and it kind of starts to create the shrinking and the opening of your cervix. The other way they can do that, and this one is good because this one is not using any sort of medicines at this point. It's a balloon catheter. So they're basically just sticking a balloon up inside you and then inflating it, and it's putting pressure on your cervix to do the same thing. Okay, so those are some things that you can do that are just, they're a little less invasive and they're just ways to start. Okay, so if they say you need to be induced, say, okay, I want to start with just doing cervical ripening stuff. I want to start with things that are not putting stuff in my bloodstream. Let's start there, okay? Or they can break your bag of waters. So that will cause the baby's head to descend and sit down on your cervix, again, trying to make your cervix do what it needs to do. I mean, that's kind of the starting point. So that's what we're going for, is get your cervix to start working or shrinking. Your risks for that, obviously, your infection, because the longer you go with your waters being broken, you run the risk of having an infection. One thing that can happen is, your baby and the cord are surrounded by this fluid. Well, as soon as that fluid rushes out, just picture your baby kind of dropping down and the cord drops down too. Well, the cord can drop down into your cervix or it can get pinned under your baby. So, I mean, if you're needing to be induced, you need to be induced. And so if this is an option, then, you can try it. And if that happens, doctors are good at taking care of those things. But those just want you to know what the risks are that are involved with it. And of course, it also starts that clock. As soon as your water breaks, you are on a timetable. Now, Pitocin. Did you say you both had Pitocin?
I did.
You did, okay. So as we've already talked about before, Pitocin is the synthetic version of oxytocin, which is great. I mean, I'm glad that they've developed it and that it can help some people. The bad thing about it is it's not naturally created by our body, so it's not creating natural contractions, and they can be really, really difficult. They can be too painful and too frequent, and they're obviously going to cause you stress. You're going to know that, but it can also stress out your baby because your baby is ready for a birth that's going to go at a certain pace and a certain strength, and this is not it necessarily, and it might be too much. So sometimes when they're monitoring your baby, the heart rate will drop too much because that contraction is too strong. So that's something that can happen. Because they're so strong, that generally makes your epidural necessary, okay? Now, the bad thing about this cycle is that, and you can start at either direction. So let's say you get the Pitocin. Well, it's gonna make everything really, really painful, so eventually you're gonna need an epidural. Well, epidurals have the potential to slow down your labor, okay? It's a numbing effect, it's an analgesia. It's a pain reliever, but it's also anesthetizing your body. So it can slow down your labor. So if your labor starts slowing, well they're trying to get you moving along for whatever reason. They're trying to keep you going. Okay, so we need to up the Pitocin. So then they up the Pitocin. Well then eventually, your epidural is gonna start to wear down and those contractions are still really strong, so we need to up the epidural. And it becomes this vicious cycle, right? So then what happens when it goes on too long?
You get a C-section.
Right. So, like I said before, sometimes these things are necessary. And so if your doctor, if it comes down to it and your doctor comes to you with any of those medical issues that you may have and say, you need to do these, you need to be induced, start with what you can, start with this and work your way down, okay? And let me get to the next, I think we're about there, to the questions that you can ask. Okay, I'm not gonna do that today. Okay, brain. In your folder, there's a yellow piece of paper. This is what I think is very helpful, and this can be used while you're pregnant, it can be used in labor, but I think this is a helpful tool. Whenever you are faced with a question during, before or during labor, use your brain. What are the benefits of what you're asking me to do? Why is this a good thing? Whatever your doctor comes in and says we need to do blah. Okay. Tell me the risks and benefits of this. Why do I need to do this? So you ask for the benefits and then you ask for the risks. What are the alternatives? Okay? Because, they may just come at you with what they want to do, but maybe there's an alternative. Okay, so they say you need to be induced. So we're going to schedule you this day and we'll start your Pitocin at this time and then we'll blah. Okay, whoa. Okay, so what are the benefits of why do I need to be induced and what are the benefits of going ahead and inducing right now? What are the risks? Are there alternatives to the Pitocin? Do I have to start with Pitocin? Well, then they might say, well, no, we could start with this, or this. Or if they say, well, we've tried the cervical ripening suppository, sorry, I forgot the name of it, but we've tried that and it didn't work, so let's just do Pitocin. Whoa, wait. Okay, I get that it didn't work, but what about the alternatives? What about the balloon catheter? Could I try that? So the more information you have, the better, and you can ask these questions, okay? Use your intuition. You guys now, from this class, and then I'm sure from looking online and from talking to other people, you have a lot of knowledge, and you have a lot of intuition, especially, if you've had another baby, you know what you're comfortable with and what you're not. And, if you're doing your research and you're listening to other people's stories, you have a pretty good idea of what you think is going to be right for you, okay? So listen to that. Listen to your doctors too, obviously, but listen to that. The last thing that I would ask you to do with your doctors is to say, well, I need time, okay? Now, a different way of looking at this, and this is how I learned it in my class, was if your doctor comes to you and says, I want to do this, or I think you need to do this, okay? You can go through these things and say, well, what are the benefits of it? What are the risks? Do I have any alternatives to this? But the last thing you can ask them is, what happens if I wait 30 minutes? Just 30 minutes. What happens if I wait? Now, if their response is, well, you're going to be in imminent danger, and, and there is a, legitimate cause to be afraid that something really terrible is going to happen. Like if that is, if you trust your doctor and that's what they tell you, okay, then you probably ought to do what they say. If their response is, well, yeah, we can wait 30 minutes, that's probably not a big deal. Nothing serious is going to happen, and you're fine. We can wait 30 minutes and just monitor the situation. Okay, well, that's what I want to do. I want to wait 30 more minutes. Okay. So you, at that point, ask them, come back in 30 minutes and we'll revisit this, okay? You keep doing that until the answer is, no, we can't wait any longer. Does that make sense? If you can continue to wait 30 minutes, then continue to wait that 30 minutes. If they're coming in and saying, well, you aren't moving along at the 1 centimeter per hour, so I would really like to blah, put you on Pitocin or do whatever to speed this along. Okay, so then when you get to, you ask all these questions and then you get to well, what happens if I wait 30 minutes before I start Pitocin? Well, nothing, that'd be fine. You're just going to be in labor for 30 minutes longer. Okay. That's fine, let's wait. Because, what did we talk about? That if you're not dilating, that doesn't mean that it's not going to happen. You might have just this massive amount of dilation in 30 minutes. And they come back in and they're like, whoa, okay, I'm sorry, you're at like a 9 right now, good deal. And then you've avoided being put on Pitocin just because they didn't think you were on their timetable, okay? So remember brain, or if you don't want to even remember all that stuff, just remember what happens if I wait 30 more minutes, okay? Any more questions? I promise I'm moving along. I know we're going to get to the getting out of your seats here pretty quickly. So prepare for the unexpected. I mean, you know, we talked about you may have some of those medical issues that come up, and you may end up having to, I mean, you never know what's going to happen, but hopefully none of this stuff is going to be necessary. But if you do end up having to have a C-section, there are things that you can ask about. I forgot to mention this one earlier. I know some people, and I don't know about the hospital policy, but you can, you know, they put the big tarp up in front of you so you can't see what's going on. You can ask if maybe they can lower that right when the baby's about to come out. So, you know, you're not going to see all the stuff, but if you want to see baby coming out, you can ask to see that. You're going to want to request immediate skin to skin, either with you or with dad. I mean, I know Woodward does that, so. Same, like I said earlier, you can ask about music or dimmed lights, just to keep it a peaceful atmosphere. Recovery is really rough from a C-section. I can tell you because I've had both. It's tough. So if you end up having to have one, go easy on yourself. I mean, we talked about letting your body heal from just birth. Please let your body heal from this. All kinds of muscles have been cut. I mean, when you go to get out of that bed, you're literally going to do like a log roll and then sit up. You're not going to use any abdomen muscles. I mean, just give yourself time and grace to recover from one of these, okay? Okay, that was I'm sorry, that took a while. That was the end of my sitting down and whatever. Now we're going to move on to the techniques, but keep calm and birth on. I think I'm going to get a shirt with that on it. Okay.
Yeah, she makes shirts.
You do? Oh, it's shirt lady. Okay. Well, I may be hitting you up for that. I was thinking about either empowered birth or keep calm and birth on. Do we need to switch?
Keep calm and birth on the back. Empowered birth on the
Ooh,
front.
I like it.
Are you through talking? Because we'll stop and then.
Yeah, go ahead and stop.
Collection of thickened cervical mucus that sealed your cervix shut for 9 months may be expelled days before or in the midst of labor. When the amniotic sac ruptures, your water has broken. It can feel like a trickle or a gush of fluid. Your cervix will begin opening and thinning, known as dilation and effacement. Once you reach about 4 centimeters, your body will move into active labor. In active labor, contractions become stronger and closer together. At 8 centimeters, you enter what many consider the most painful part of labor, transition. At 10 centimeters, you're fully dilated and may feel the urge to push. This is your signal that the second stage of labor has begun. Your baby will move down with each contraction. The 3 separate soft bones of his head will temporarily overlap so he can pass through the snug birth canal. Your baby's scalp will come into view. When the widest part of his head is visible, your baby is crowning. With several more pushes, your baby's face, shoulders, and body will emerge. In the third and final stage of labor, your placenta detaches and is expelled. With your baby's first breath,
Okay.
in the weeks before birth, your body...
Okay, good. I don't know if that'll take me right back to that. So, that was just a quick version of what we just went through. You know, very quick, obviously. One of the things I wanted you to notice, and I should have pointed it out during that, but at the position of the baby, get my baby doll. Which will, when we start getting on the floor here in a little bit, I'll show you this again. But if you noticed in the video, did you see that the baby was, you know, obviously head down, but did you see that the spine was out this way?
Mm-hmm.
And then they kind of rotate as they're coming out. Okay, so just make note of that. But that was just to give you kind of quick visual. If you needed, you know, if you're a visual person, that's what it's going to look like, okay? Or what it's not that quick and easy, obviously. But okay, comfort measures. Okay, you have a list of these things and others, but this is going to be your cheat sheet at the hospital. You can try aromatherapy, hydrotherapy, music, hypnotherapy, freedom of movement, massage, breathing, use your birth ball or a peanut. Do you guys know what a peanut is? Basically looks like a birth ball, but in the shape of a peanut. Woodward has one, so you don't need to go buy one. Some yoga poses we're going to go over. There's this tense and release practice that we can do. pelvic pressure, dancing and changing positions. That's just a quick overview of all the things that we're gonna talk about. These first few are things that we're gonna do while you're sitting down, and then we'll move to the floor to do the rest of it, okay? So, okay. Okay. How many of you guys, or girls, whatever, use oils? Or know someone who uses oils? Oils? Yeah, you probably use them in your massages, don't you? Okay. So, you know, if you're on Facebook or, you know, alive in the world today, you've heard of essential oils, right? Okay, so everybody knows somebody that has them. But there is valid evidence and research behind aromatherapy and the effects it can have on your mental state. Okay, and again, we're focusing on staying calm. Here, real quick, as I'm talking, smell all those and then tell me what you like the best. And then I'll make you a bag. Okay. So the scents
Wasn't it
can.
Gentle Baby?
I'm sorry. No, it's
Stress
peace and
away,
calming.
peace
And
and
then,
calming.
yeah, I don't have Gentle Baby.
Gentle Baby is one that can be applied to the perineum
Oh, okay.
to help alleviate tearing.
Good to know. Okay, I'll have to add that to my thing here. So certain scents have a calming effect and also stir emotions and memories that help our bodies produce the endorphins and oxytocin needed to reduce the perception of pain. You know, this can be, you know, when you smell a familiar scent, it smells like grandma's house. You know, it's the same idea. Like you automatically just, oh, you know, or you smell bacon. I mean, bacon is what I think of when I think of my grandma's house. Because that's what I was always cooking.
That should be everybody's house.
Right? I mean,
Why just there?
Exactly. I mean, bacon always has a calming effect on me. I love the smell, honestly, of coffee. You know, so you may not like these smells, and if you love coffee, get your little baggie of coffee beans and take it to the hospital with you. No joke. Whatever scent really just makes you feel good. If it's his cologne or his deodorant or whatever, you know, if it's whatever it is that you smell and you think, oh man, I love that smell, and that just, I could just sit here and smell that all day. I mean, if this is your fabric softener, you know, wash a pillowcase, take the pillowcase with you. But okay, which one did you like? Did you have a favorite? Not really? All right, I'll pick one for you. Did you like one? I mean,
Lavender's always my
you like
favorite.
lavender? Okay.
I would douse my whole house in lavender. I do douse my whole house in lavender.
I'll make one. So, if you are interested in doing oils, there are several ways that you can do it. I mean, you could do this. You could put it on a cotton ball, put it in a bag, and just have a baggie that you smell. You can make a roll-on, which I'm sure you know what a roll-on is. But basically, you just take a bottle. They have bottles that have little roller balls on the top of them, and you mix your oils with a carrier oil, which can be, did I put that on there? No, I just put it on there. It can be coconut oil or even olive oil or almond oil. You can Google this stuff, but you get a carrier oil and mix it together, and it's in a roller ball, and then you just put it on your wrist, or you put it on the back of your neck, or you can put it across your forehead, wherever you're going to smell it. But that's one way that you can do the aromatherapy. You can diffuse it with a diffuser. To be honest with you, I don't know if when you're in the midst of going into labor and you're in the delivery room, I don't know if you're going to want to mess with setting up a diffuser. You can. Now, you might be like, hey, go set up the diffuser, and if you guys have no idea what you're doing, then, you know, that might be a little...
He's been trained.
Okay. He knows. Okay. I love peace and calming, so I'm going to give you peace and calming. And which one was you?
It was the peace and calm.
Peace and calming? Okay, that's my favorite of all these. Well, and I like Stress Away, too. Stress Away kind of has a chocolate smell to me, so I like that.
I
as
think
well.
that one and the lavender combined would be
The peace and calming and lavender, yes. Well, here. I do actually put that in a roll on my daughter. So, but if essential oils are not, it does not have to be these. Like I said, it can be coffee. It can be a lotion if you have a favorite lotion at home that you like the smell of. But anyways, this can be something that can bring calming. And I'm sorry, this is probably going to be kind of overwhelming in the room. Hopefully nobody's has an aversion to any of this, but okay. Anyways, this is a way to calm your mind and to focus and to bring, bring you back to center, if you will, while you're in the midst of labor. Okay, so that's aromatherapy. And don't worry about your bags right now, just leave them sitting there. We'll get to that in a minute. We're going to do a little exercise where you can kind of see how it helps you deal with the sensation of pain. No, I'm not going to like throw rocks at you or anything. Okay. So if you're going to use oils or any sort of scent, you're going to want to test it before you go and make sure that you like the scent, that it's not too strong, and that that you have it ready to go. And honestly, you may want a couple of options because you may find that in the midst of labor, one of them just repulses you. You're just like, nope, that's not what I wanted. So have a couple of options. Okay. All right, hydrotherapy. It's basically just water. Now, we talked about baths, so when you're still at home, you can go get in the bath. If you don't want to sit in a bathtub, one thing that is great is using a shower wand on your belly. And it's like kind of a water massage on your belly. And I've seen birth videos where women do that, and it feels really, really good. It just relaxes all those muscles. You may see if the hospital has that option. I mean, oftentimes their showers are going to have something like that because it's going to be a hospital shower, so it would make sense that they would have that. But you might ask. So the way this works is obviously it's relaxing your body and your muscles, and it's soothing. You could run a bath at home or at the hospital if your waters haven't broken. That's always the catch. And if your labor facility has a tub, I don't know if Woodward does water births, but that's something you can look into. The benefits of water birth is it reduces the pressure because you're being, supported by the water, and it reduces some of the pressure that is on your body when you're standing up. And the transition is easier for baby because it's going from water to water, so it's not quite as shocking. I mean, you're going to pull baby up out of the water, but it's still just a smoother transition. And like I said, you can use a shower wand. If you're going to do that, I would recommend having a stool, some sort of stool to sit on, because if you need to sit while you're in labor, you're not going to want to get out of the shower and go sit down and then get back in. So have a stool, and then you can use your little wand on your belly. And I didn't do it, but like I said, I've watched videos and I have seen women that have done it, and it looks like it's just really, really relaxing and feels very comforting. Okay, music. So I don't know about you guys, but if you've had a stressful day and you want to get in the car and crank up the music and roll down the windows and go for a drive, that's like some of the best therapy out there, right? It's very calming. It's got a great effect on your mindset. So the same is true in labor. If you have music that just really has a calming influence on you, or even just something that's a distraction. Like in early labor, have a dance party at your house. That's always fun, and that's movement, So get your music going and have a dance party at your house. Probably not at the hospital, they won't appreciate that, but the music doesn't necessarily have to be classical music and all, super soft and smooth and relaxing. It doesn't have to be that. If that's not what calms you, then pick something else. I mean, if you love country music, get a country music playlist. If you love Frank Sinatra, get yourself a Frank Sinatra playlist. You find, like when you're doing dishes, or when you're just chilling out and you just want to listen to music, or when you're going on those drives and you need music that's just going to let you unwind, take note of what that music is, because that might be what helps you during labor. Whatever music is your go-to, even if it's Pink, or if it's, whatever, Metallica, AC/DC, whatever it is, you're an individual and you know what works for you. Now, obviously, I don't think you can really rock out at the hospital too loud because you don't want to disturb everybody else, but play whatever you want to play. Now, if music is one of your techniques that's going to work for you, I would recommend having some backup music that is a little more soothing and calming for when things get a little bit more intense and you don't want loud, crazy music going on. Okay, so have an alternative to that. But I don't know about you guys. I don't do this very often because I'm old school. I mean, up until a year or two ago, I was still buying CDs. But if you all are the type that like to make playlists, sit down and make some playlists. Do it together. Put some playlists together that you think she's really going to enjoy during labor, stuff that you like to sing along to. My husband and I have battles on 80s music of who knows the the artist and the name of the song, he beats me every time, like badly. Yeah. That's why I don't ever bet anything on that. But for me, that is something that it's a fun memory. It's something we enjoy doing together. And so like I won't be, but were I to go into labor again, that might be something that I would do with him at home. And then even have an 80s playlist that I listen to in the hospital, and then eventually transition into something comforting. But that's how you can use music. You can do dancing. We'll talk about this in a little while, that the hip movement of dancing is a good thing. So if you like to dance, I'm terrible at dancing, but if you like to, no one says you can't get up there in the hospital and do some dancing to your music, just nothing crazy. You don't want to fall. Create a playlist. Okay, but also check with your hospital and I don't think they're going to have a problem with you playing music in the room, but you might check, like if in the C-section scenario, can you play music in there? And then also, make sure that it's just okay to have music continually going in your room, but I really don't think that anybody's going to have a problem with that. Again, as long as you're not having like a concert level, volumes. So, okay. I think this one is great. You guys are probably this is the one where I think some people feel kind of weird and feel kind of awkward, because hypnotherapy, and it's not hypnosis, we're not hypnotizing anybody, but the idea of meditation or having a script that you kind of read or say to your partner as she's having contractions, it can really work for some people. So this technique gives the mother something to focus on that reduces stress, which in turn produces hormones and produces endorphins and reduces pain. If you're gonna have a picture that goes along with whatever your focus thing is, it can be a picture of what the person is describing, and you would want to use the same phrases every time. So you can kind of have a script written out if you want to, but use the same words so that it kind of triggers. Like when you're in the midst of a contraction and your partner starts saying these phrases, that's your cue that, okay, I'm going to focus on what he's saying and I'm going to concentrate on that, and it helps you get through your contraction. So having the same words is helpful. This script or scenario that you want to talk about, it can be real. It can be a fantasy place that you want to go, like a dream vacation. You can just be describing a nature scene or a specific memory. Use photos, be descriptive, and you can write a script. So basically, like, okay, tell me your favorite vacation that you've ever been on. Do you have a favorite? No? Do you have a favorite place you've been? Someplace you'd like to visit?
The only vacation I've been on is my senior trip.
Okay. Was it good memories?
Yeah.
Yeah, kind of. Okay, let's try a different thing. So when you want to just unwind and relax, what's your favorite place to go to? Do you have a favorite place you like to go to? Even if it's just in your house, like in a place in your backyard or your couch.
Horses.
Where?
Horses.
Your horses. Okay, perfect. So you like to go ride horses. Okay.
Ass fishing.
Bass fishing?
I said, what about the day you kicked your dad's ass fishing? She
Oh.
caught 2 bass that were like this long out on my pond.
Okay. Well, hey, if that's okay, anybody in here Harry Potter fans? One, kind of, sort of. Okay. So what I think of when I think of this is like they have their happy memory to create the Patronus. Sorry, my nerd is showing, but that's what I think of is think of something that just really makes you happy, makes you calm. If it's, if you have a favorite, I don't know, a favorite restaurant or a favorite, I'm trying to think, do I have any other ideas here? Oh, okay, so maybe you don't have a vacation that you've already been on, but there's like, would you love to go to the beach, or would you love to go skiing, or would you, what's your dream vacation? That might be an easier one to do. Find a photo that makes you think of that vacation. Think of some, enough things to talk about and for your partner to say to you that are going to get you through a contraction that are describing that place. Okay? And it doesn't have to be a place, it can be something else. You can talk about your other children that you have, and you can use pictures of them. You can use pictures of the nursery that your baby's going to be in. I mean, all of this is just about visualizing something that's going to be calming to you and also having somebody describe something that's calming to you. The other things that fall under this category are prayer, meditation. That's supposed to say mantra. I found my own. I knew I would have some sort of spelling problem, and there it is. Mantra. So I know that sounds kind of crazy, but if your mantra is something about your baby, like, this is for my baby, I'm trying to get my baby here, or, I mean, you can make it rhyme or whatever, but if you come up with just a couple, like a 2-sentence phrase that's about getting your baby here, use that phrase during your contractions and just say it over and over, either in your mind or out loud, and that's maybe something that you find helps get you through a contraction. You can use Bible verses. If there's a Bible verse that brings you comfort, use that. Okay, and partners, this is where you come in on this part of it. You have to be the one that is doing the describing, because she's in the contraction, right? So if you practice these things in advance and she finds that this is what works for her, then this is what you do, even if you feel silly. You guys come up with what helps calm her, what dream vacation or favorite place really makes her feel calm, and then that's what you describe. And if you need to write a script, like I said, write a script and just have it there with you, and take a note card and read it to her every time. And eventually you'll be able to say it no problem. As far as the picture goes, you can print a picture, or you can just have that picture on your phone. And so every time you're going to start a contraction, you get your phone and you focus on that picture. And I have a picture here. Okay, so let's say your dream vacation is a beach. Okay, so then this is when you would say, okay, honey, I want you to focus on the rolling waves and the smell of the salt in the air. Can you feel the sand between your toes? And it's so pretty and so clean and so white. Imagine yourself laying on the beach with the sun beating down on you, and you're reading a book. Okay, this is the example of what you can come up with. Okay, again, I know you might think it sounds really silly, but you'd be surprised that if she is listening to your voice and she is listening to what you are saying and really focusing on either a picture or your words, it can have a major calming effect and can reduce her pain. So that is hypnotherapy. Okay, breathing. Now, we are not going to do, okay? We're not going to do any breathing that you've probably ever seen on any TV show ever. We're going to do our own type of breathing. But I want to tell you why breathing is helpful. So, I mean, when you're running a marathon, you're breathing, right? You're breathing on a certain rhythm generally and stuff like that. That's key in exercise, is to breathe in and out on a regular basis. Well, part of that is saturating your body with oxygen, okay? So it also helps keep your cortisol levels down, which that is a stress hormone that pops up. So you're keeping your stress down, and that helps combat the fight or flight. So this is why we do breathing techniques. Is a lot of times when you're in pain, I mean, think about it, when you've fallen or whatever, your first tendency is to, and you hold your breath, right? Well, so if you start doing that during a contraction, you're not getting the oxygen that you need, and you're not keeping your stress level down, and you're creating that fight or flight syndrome in your body. For me, I told you before, the breathing is what got me through, but more than anything, it was concentrating on the mechanics of it. And I'll show you here in a second what type we're going to do, but when you start focusing on the way you're breathing, that gives you something to keep your mind on. So we're going to try 2 different types of breathing, and you can see whatever works best for you. I will say this, that no matter what techniques you use, you're definitely going to want to do some form of breathing, okay? Because you don't want to hold your breath, and you don't want to do high, shallow breaths when you're in a contraction. Even if you're focusing on these other things, concentrate on just deep, calm breathing, okay? But this is the example I'm going to give you. Okay. So at the beginning of every contraction, and this is going to help you guys know when she's starting a contraction, because she may not be like, oh, I'm starting. But if she takes a big, deep breath, then oh, I think she's about to start. You can start your timer if you're still timing. Or you can get to her side because you know she's about to have one. So you're going to take a big, deep cleansing breath at the beginning of it. Then, how many of you are singers or have sang before? Okay, the filling of your diaphragm? That's what we're going to concentrate on. So you're going to when you take your deep breath, well, and don't make it a deep breath, but when you take your breath, you fill up your diaphragm first, and then you fill up your chest, so it's, and then when you breathe out, so it's abdomen, chest, and then you're gonna breathe down and out. I know that sounds weird, because obviously your breath is not going down and out your body, but this is what you're telling your brain, this is what you're thinking, is I'm breathing into my belly, into my chest, and then down and out. And when it's down and out, what you're visualizing is literally the air going out your birth canal, okay? It's opening things up, okay? I know that's not what's physically happening, but that's what I want you to visualize, because it helps, it really does. So we're gonna do this together. So, and it helps, sometimes it helps if you put your hands on your stomach to feel yourself, or you can do actually both, because you wanna feel yourself start to fill up here, and then fill up your chest, and then breathe down and out. So, okay, we're gonna take a big deep breath. Okay, fill up your belly, chest, down and out. Belly, chest, down and out. Keep going. Makes me sleepy. But it's calming, there you go. Okay, one thing I want you to think about too when you're doing that, because I just did it to myself a little bit. We're not taking these huge deep breaths, because that's just gonna make you dizzy. Relatively normal size breath. I mean, it's a little bit bigger than a normal size breath, but it's not a huge, because then, yeah, you're gonna wanna pass out, okay? So keep it kind of normal breathing, but concentrate on filling up your belly and your chest, and then down and out, okay? So that is the first one. The second one is really easy, but this one I was told is actually pretty good for like your transition and getting into pushing, because this is something that it's literally you're just breathing in and out, just a steady breath, just, you know, nothing fancy, and you're not concentrating on any rest of that. But what you're doing is you're counting. So it's 1, 2, 3, 4. Okay, you know, slower than that, but you're counting as you're breathing in and out. And the idea is that you're just focusing on the counting and the breathing and nothing else. And the second that your mind starts to wander to something else, whatever it may be, if your mind starts to become fearful, your mind starts to whatever, you know, it just starts to drift onto something else, well then you start back over with 1. You're like, no, I'm not counting. And go back to 1, 2, 3, 4. That is really good for when you're in that tunnel vision and you want to just stay focused and you don't want to be thinking about anything else. Because you probably aren't even going to be able to do the abdomen, chest, down and out thing. That might even be too much to grasp at that time. But counting just 1, 2, 3, 4, you can. Okay. I'm not going to make you do that one because that's pretty self-explanatory. But remember that one. If you just get to a point where you can't do the other breathing, try to do that one. Okay. I think we're ready to practice these real quick with, yep, okay. So I have another balloon. And no, I'm not gonna do ping pong balls again. Have any of you had other birth classes? Because I know we talked about that you haven't. No, nothing? Okay. Okay, so these are balloons filled with ice. Don't pick them up yet. So what happens when you hold something really cold in your hand for a long time? It starts to hurt. Mm-hmm. So I'm gonna get my phone. I'm gonna do this with you, and we're gonna time it. I'm gonna have you just pick it up in your hand for, I think we'll just do 45 seconds. Start with, and you're just going to, don't think about anything else. I just want you to think about what that feels like in your hand, okay? Excuse you. Let's see. Okay, so everybody pick it up and just put it in one hand. Hold it pretty tightly so you can feel the cold. We're gonna